Welcome to the Omni Dental podcast. So I want you to picture this. You just survived like an hour in the clinical chair.
Oh, yeah. We've all been there.
Right, and half your face feels like absolute rubber from the local anesthesia. Your adrenaline is rapidly crashing, and your stomach is just absolutely growling. So what is your very first move?
Well, I mean, if you're like most people, you'd probably say, I'll just grab whatever's in the drive-thru on the way home, you know?
Exactly. But if you do that, you are actually sabotaging your body's healing process before it even begins.
You really are. And it's because we treat clinical visits as these, like, isolated chores. You go in, you endure the lights and the tools, and the second you step out the door, you expect to instantly resume your normal life.
Like nothing happened.
Right. But the physiological reality is that your body is entering its absolute most vulnerable state of recovery the moment that appointment ends. So ignoring that transition is just a massive mistake.
Which is exactly our mission for today's deep dive. We are exploring a highly practical, yet honestly completely overlooked aspect of your personal health routine.
Yeah, the aftermath.
Exactly. We are going to look at the precise strategy of what you should do, and more importantly, what you should eat immediately after a major dental or aesthetic appointment.
And we've got some really great source material for this.
We do. To do this, we are pulling from two specific sources. First, we have the official clinic overview of Omni Dental, which is located in Arlington Heights, Illinois. And second, we have this highly specialized hyper-local guide published in April 2026 by their lead practitioner, Dr. Bylis Poles.
Right, the dining guide.
Yeah, it's titled Post-Dental Dining, Gentle Eats Near Omni Dental.
And I think the overarching theme of these materials is just this radical shift in how we view the timeline of patient care. Like, traditionally, the provider's responsibility ends at the exit door.
Right. You pay your bill and you're on your own.
Exactly. But what we're seeing here is an attempt to extend that care into the community using local geography and specific food choices to actively manage a patient's biological and psychological decompression.
Which is fascinating. So let's ground this in the physical location first, because the geography is actually a major component of this strategy. So Omni Dental is stationed at 305E Rand Road in Arlington Heights.
Okay, good to know.
But their service area is massive. They are pulling in patients from Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows.
Oh, wow, that's a wide net.
It is Schaumburg, Wheeling, Des Plaines, and even Elk Grove Village.
Drawing patients from that many surrounding municipalities, I mean, that really indicates that this is a destination practice.
Absolutely.
People are willing to bypass their neighborhood walk-in clinics to travel for, a very specific tier of comprehensive care.
And when you look at the menu of services they offer, comprehensive almost feels like an understatement. On the traditional dental side, they handle the really heavy-duty procedures.
Just serious stuff.
Yeah, we are talking deep teeth cleaning, root canals, sleep apnea appliances, and bone grafting. They also specialize in all-on-4 dental implants.
Oh, right. For those who don't know, that's a complex surgical procedure where an entire arch of teeth is anchored to just 4 titanium posts embedded in the jaw.
Exactly. It's major work.
Yeah.
But then on the exact same service list, they have this really extensive menu of aesthetic and cosmetic services.
Yeah, the aesthetic side of their practice is incredibly robust. I mean, they offer the standard injectables like Botox and dermal fillers, but they also offer advanced treatments like Sculptra.
I was reading about that. Sculpture is super interesting.
It's fascinating because it's a biostimulatory injectable, right? Instead of just filling a wrinkle with a gel like traditional fillers, it uses polylactic acid to actually trigger your body's natural inflammatory response.
So it's commanding your own cells to produce new collagen over several months.
Exactly. It's working with your biology.
Yeah.
And they don't stop at injectables either. They offer platelet-rich fibrin therapy.
Right, PRF.
Yeah, this is where they actually draw a small amount of your own blood, spin it down in a centrifuge to isolate this yellow serum that's just packed with your body's natural growth factors.
And then they reintroduce it to injured tissues to drastically accelerate healing.
Exactly. They also do skin treatments like microneedling, which creates microscopic punctures to trigger skin rejuvenation. They do laser pigmentation removal, hydrofacials.
And beyond the face, they provide permanent makeup services, right? Like microblading for eyebrows, lip blushing, and scalp micropigmentation, alongside whole body treatments like laser hair removal and IV drip therapy.
Yeah, it's a huge list.
Okay, I have to pause and just throw a flag on the play here.
Uh-oh, what is it?
Well, I completely understand a dentist performing a root canal or anchoring titanium implants into a jawbone. That makes perfect sense. But like body sculpting, scalp micropigmentation, 4V drip therapy.
You're skeptical?
Extremely. It feels like taking your car to a mechanic for a transmission rebuild. And while the car is on the lift, the mechanic offers to tailor your suits, you know? It just feels like a massive leap outside of a dentist's lane.
Well, okay, I totally see the logic in that skepticism, but I think it stems from a bit of a misunderstanding of what a modern maxillofacial professional actually studies.
Okay, explain that to me.
Well, if we look at the credentials in the source material, Dr. Bilas Poles has over a decade of experience and specializes in dental injuries and emergencies.
Right.
Handling facial trauma requires this, like, millimeter by millimeter mastery of craniofacial anatomy. Dentists spend years mapping the trigeminal nerve, the vascular networks of the face, and the underlying muscular structures.
So injecting a neurotoxin like Botox into a specific facial muscle is basically child's play compared to navigating a drill around major nerve bundles in the jaw.
I mean, child's play might be a strong term, but the anatomical foundation is arguably superior to many other practitioners who offer aesthetic services. A dentist routinely administers local anesthesia deep into nerve blocks that are located like fractions of an inch from major arteries.
Wow. Yeah, when you put it like that.
Right. Their daily practice relies on profound anatomical precision. So expanding into aesthetic treatments like skin rejuvenation or using platelet-rich fibrin to heal both a dental extraction site and a microneedling site, it's actually a highly logical integration.
That does make a lot of sense.
Yeah, the clinic's philosophy is rooted in this patient-first mentality, combining this advanced technology with environmentally conscious practices to act as a unified hub, not just for functional health, but for aesthetic confidence too.
Okay, I'm sold. Let's walk through the actual patient experience then. Let's say you just spent 2 hours in their chair on a Tuesday afternoon. Maybe you were fitted for Invisalign or you had a laser pigmentation treatment.
Okay, setting the scene.
Right. Their clinic hours run Monday through Friday, 10 a.m. to 6 p.m. So you are stepping out onto Rand Road right in the middle of the day. Regardless of the specific procedure, your tissues have been manipulated, your face or your mouth is highly sensitized.
And your body is also managing a complex cocktail of neurochemicals.
Tell me about it.
Well, you have been in a clinical environment, which naturally elevates cortisol and adrenaline. Your sympathetic nervous system, which is your fight or flight response, has been quietly humming in the background to keep you alert while a professional worked on your face.
Which brings us to the core of today's deep dive, the
Right.
post-visit recovery strategy. Dr. Pohl's April 2026 dining guide is essentially a biological instruction manual disguised as a restaurant review.
That's a great way to describe it.
Yeah, he lays out 4 strict rules of engagement for eating after an appointment. You need to choose soft foods, absolutely avoid anything very hot or spicy, prioritize quick service, and lean heavily into comfort food.
And the genius of this guide is really how it translates those complex physiological needs into simple, actionable neighborhood recommendations. Let's look at the biological mechanics behind the rule against hot and spicy foods, for instance.
I really want to dig into that because when my mouth is sore, I naturally gravitate towards something like, a steaming bowl of spicy chicken noodle soup.
Oh, bad idea.
Right. Based on this guide, eating hot, spicy soup right after a procedure is essentially opening up a 4-lane highway for inflammation straight to your gum line.
The 4-lane highway is literally the perfect analogy for vasodilation. Spices containing capsaicin bind to pain receptors that are already exposed and hypersensitive from your procedure.
So it just amplifies the pain.
Exactly. And furthermore, introducing high heat causes the blood vessels in your mouth and face to rapidly dilate. Expanding those vessels rushes a massive volume of blood to the newly treated tissues.
Which causes the swelling.
Right. It increases hydrostatic pressure in the area, which you experience as localized swelling, throbbing, and just acute pain. So by sticking to neutral temperature, non-spicy foods, you mechanically protect the site from thermal shock and chemically prevent unnecessary swelling.
Okay, that covers the temperature and the spice. But I want to examine the third rule, the emphasis on prioritizing quick service and proximity, because Dr. Pohl specifically highlights places near the Omni Dental Clinic in Arlington Heights.
This is where we circle back to the neurochemicals we discussed earlier.
The adrenaline.
Exactly. When the appointment concludes, your brain signals that the perceived threat is over, so your adrenaline production just shuts off. Your parasympathetic nervous system, which is the rest and digest network, takes over.
And that causes a crash.
A massive one. This transition manifests as a sudden heavy energy crash.
It's that feeling when you finish, like a massive, high-stakes presentation at work, and the second you sit down at your desk, Your limbs feel like lead and you can barely keep your eyes open.
Precisely the same mechanism. So if you attempt to drive a long distance with a sensitized mouth, or if you sit in a crowded, noisy restaurant with slow service, while experiencing that cortisol drop, you are forcing your body to remain in a state of
You're
stress.
fighting the healing process.
You are actively fighting your body's attempt to transition into a healing state. Finding a quick, quiet spot in the immediate Arlington Heights vicinity honors your biology's demand for low-friction rest.
That is so important. So let's trace the actual route Dr. Poles mapped out in the guide, starting with the options for patients who actually have the time to sit down and decompress.
Okay.
The first recommendation is the Garden Bistro. The guide notes their fresh salads and soft sandwiches, but it specifically highlights the calm atmosphere.
Right, because the environment acts as an extension of the clinical care. Low sensory input, meaning minimal clattering dishes, soft lighting, and a quiet room, allows the nervous system to remain in that crucial parasympathetic healing state while you consume easily digestible calories.
Now, the second sit-down recommendation is Bella Pizzeria, and I'm highly skeptical here.
I knew you would be.
I mean, when I think of pizza, the very first image in my head is burning the roof of my mouth on a bubble of scalding, rubbery cheese, and then tearing at a tough, chewy crust. That sounds like an absolute nightmare for a mouth that just underwent a deep teeth cleaning or an extraction.
Well, if you order a well-done pizza directly from the oven and try to tear into it, you would absolutely violate the recovery protocols. But the guide is very specific about how to navigate this menu.
Oh, it is.
Yeah, Bella Pizzeria is recommended for their hearty pasta dishes and for the soft crusts of specifically warm, not scalding hot pizzas.
Okay, but even with a soft crust, you are still forcing your jaw to do a significant amount of work. Is the biological payoff of a piece of pizza really worth the mechanical effort of chewing it?
That's the trade-off, right? We have to evaluate the mechanical stress of chewing against the biological need for satiety. When you bite into tough proteins, the immense pressure of your jaw muscles transfers straight through your teeth into the periodontal ligaments and the underlying bone.
Ouch.
Yeah, that sheer force is agonizing on fresh dental work. However, your body is desperate for dense calories to fuel the cellular repair process. Warm pasta, or a soft, modified piece of pizza crust, provides massive caloric satiety with minimal mechanical shear force. It delivers deep comfort without traumatizing the tissues.
Okay, that makes the distinction clear. It is about modifying how you consume the calories to bypass the physical trauma.
Exactly.
But what if you are a patient who booked a laser hair removal session or an Invisalign checkup during your lunch break? You don't have time to sit down for a plate of warm pasta. You have to get back to the office.
The guide addresses the time-constrained patient by shifting the focus entirely to liquid and ultra-soft nutrition.
Right. The guide points directly to Fresh Wraps Cafe, specifically calling out their healthy bowls and smoothies. Smoothies seem like the ultimate post-dental life hack.
Oh, they totally are.
If you just had an implant placed or a dermal filler injected into your lower face, a smoothie lets you bypass the mechanical gears of your mouth entirely. You are getting the caloric intake without any of the muscular movement that could displace a filler or disturb a suture.
And you are achieving rapid gastric emptying. Liquid calories process quickly, providing an immediate blood sugar spike to counteract the post-adrenaline crash, all while keeping the facial musculature completely at rest.
Now, for a lighter option, the guide also routes patients to Urban Grind Coffee House. It suggests grabbing a soft pastry alongside a coffee or tea. This is framed as a quick pick-me-up for when you just need a small snack to stabilize yourself before getting back on the road.
Notice the deliberate curation of texture and temperature across all these local options. Soft sandwiches, warm pasta, cold smoothies, tender pastries.
Yeah, there's a real pattern.
Every single item serves the dual purpose of delivering energy while maintaining physical protection for the maxillofacial region.
Which brings us to the final stop on the Arlington Heights culinary tour, and arguably the most important element of the entire guide, the reward.
Yes, the psychological component.
Exactly. Dr. Poles explicitly recommends visiting Sweet Treats Bakery. He advises patients to pair a soft pastry with a warm drink, specifically framing this act as a psychological reward for completing the appointment. I really want to look at the psychology of this because it seems to change the entire narrative of the day.
It fundamentally alters the neurochemistry of anticipation. You have to remember, human beings are predictive creatures. If your mental map of Tuesday afternoon is simply endure painful dental surgery and go back to work, your brain will flood your system with stress hormones hours before you even arrive at Omni Dental.
You spend the entire morning dreading the drill.
Exactly. But if you intentionally program a guaranteed pleasurable outcome
Mhm.
into that timeline, if your mental map becomes, I will complete my clinical procedure and then I'm going to walk down the street to Sweet Treats Bakery for my favorite pastry, you introduce dopamine into the predictive loop.
That is brilliant.
The anticipation of the reward actively dampens the anxiety of the procedure itself.
It is just a brilliant way to weaponize your own psychology in favor of your health.
Mm.
You are taking the ethos of the comfortable patient-first care happening inside the clinic at 305 E Rand Road, and you are weaving it directly into the fabric of the local community.
Yeah, and by publishing this guide, the clinic is acknowledging that healthcare does not occur in a vacuum.
Mm.
Healing is an active process that requires specific environmental conditions, and they're using the restaurants of Arlington Heights as the literal tools to create those conditions.
Let's summarize the strategy we have uncovered today. If you live anywhere in the massive footprint surrounding Arlington Heights, from Buffalo Grove down to Elk Grove, Village Omni Dental provides a truly staggering array of advanced dentistry and modern aesthetic services under one roof.
Incredible variety, really.
But the true marker of their expertise isn't just the technology they use in the chair, it is the fact that they have a definitive, biologically sound game plan for the moment you leave it.
And the protocol is simple but non-negotiable. Protect your sensitized tissues by avoiding capsaicin in high heat to prevent vasodilation and inflammation.
Right.
Bypass mechanical stress by choosing ultra-soft foods or liquids like smoothies from Fresh Raph's Café, and manage your inevitable adrenaline crash by staying local and honoring your body's need for immediate, low-friction comfort.
Absolutely. So take this framework and apply it to your own life. The next time you schedule any kind of medical, dental, or aesthetic appointment, do not leave your recovery to chance.
Please don't.
Plan your reward meal before you even sit in the clinical chair. Identify the exact local spot where you will secure soft, comforting food. You will be astonished at how simply having a specific, pleasant destination to look forward to reduces your pre-appointment anxiety.
It makes you wonder, if a local dental clinic can map out the perfect community environment to heal your nervous system after a routine procedure, how completely backwards is the rest of our modern healthcare system,
That's a great point.
where we are routinely expected to endure major physical trauma and then just, navigate our own way home through rush hour traffic. It really highlights what we're missing.